Okay, awesome. Welcome, everybody. We're so excited to see you today. We are thrilled to be joined by Miss Sara Mathew, who is an administrator at Weill Cornell, for another installment of one of our Real Talk Q&As with incredible professional women of color leaders in their fields, to give us a peek behind the curtain, not only into their current work, and in this case, Sara is at Weill Cornell, but also a little bit more insight into their personal stories, how they got to where they are today. And we're hoping to leave you all with not only an insight into career paths for yourself as an administrative professional in the healthcare field and potentially at Weill Cornell, but also into some of the wisdom and lessons learned that Sara has gleaned along her professional journey. So Sara, would you mind introducing yourself and just give us a quick, just give us a quick background on who you are and what you do.
Absolutely. Thank you, Kiki. And I'm very honored here to be part of today's session. So happy to speak to all of you. I currently work as the Senior Administrator for the Trauma, Burns, and Bariatric Surgery at Weill Cornell. A little background about how did I come here. I was born and raised in Mumbai, India. I did my undergraduation in engineering. So during my undergraduation, I kept thinking about life after, what kind of job I would be doing. And my mother worked in a hospital over there. And I would see that she would have this immense amount of satisfaction. She would come home at the end of the day, sometimes at 8 p.m., sometimes at 6 p.m. And she used to be the manager for the emergency room. And I would ask her, how are you so happy and excited to go to work the next day, knowing that you might be working for 12, 13 hours? She said, this is the best job ever, helping people when they need me. I'm happy to do this for the rest of my life. And I think that really struck. And I was trying to think, okay, so what would be that particular job for me where I would be so excited to go 7 a.m. in the morning? Does not matter that I might come back home at 5 p.m. or 7 p.m., work on the weekend. It took me a year to figure it out that healthcare might be that field, and healthcare administration might be that, the perfect job for me, because I didn't look at it as a 10-year career. I didn't look at it as a 20-year career. I thought that this has to be like a lifelong mission for me. So I moved to the US when I was 21, and I enrolled for grad school at University of Minnesota. I did my master's in healthcare administration. Post that, I moved to New York City. New York City reminded me of Mumbai, where I grew up. So I was like, okay, that's home for me now. And I've been working here for the last 10 years. I started at Mount Sinai. I worked as a manager for vascular surgery, and just moved up from there, went on to manage all of the outpatient surgery at Union Square. And in 2016, I moved to Weill Cornell as they were recruiting for a manager for the trauma and the burn center. It's a very unique position because this is the only hospital in New York City that has both a level 1 trauma and burn center. And I was like, I can't pass up on this opportunity. I could learn skills that I could probably not learn in any other hospital or position. So that's kind of been like my journey from India to Minnesota to Manhattan now.
Amazing. And Sara, I'm so curious. I mean, the transition from India to Minnesota must have been quite a culture shock. Can you give us any insight into, how did you personally navigate that transition? What were some things that helped you as, somebody coming from outside of the US to stay motivated and, maybe overcome any moments when you doubted yourself when you were making that transition?
No, absolutely. Initially, I was just so excited. I was just excited to move out of my parents' home, go to a new country, start my program in something so brand new. And then once I was here, a few things were very different for me. One, the healthcare system. India's healthcare system, there's no insurance, or at least until 10 years back, a concept of insurance did not exist. It was all out of pocket. And when I started doing my master's here, concepts like deductible, referral, I didn't make sense to me. So I had to like start from like the basics, because that's something that everyone in my class knew what that meant. Like going to a PCP, getting a referral, you go to a specialist. That kind of concept does not exist in India. So I had to like really go take 10 steps back, go to my advisor and be like, hey, can someone even give me like a ABC of how healthcare and hospitals and primary care and specialists, like the whole system, how does it work here? The whole insurance system, I did not know that either. So I had a lot of learning to do, but I was ready to put in that work. I had a very, like a laser focused mission that I need to complete my education. It's a 2-year program. And so I was very focused on doing all the additional work that I had to do. I also volunteered with a bunch of clinics in Minnesota because I was like, I need to get some, like a day-to-day experience about how healthcare and clinic work here. So it was very interesting. And another insight for me, which I thought, like being in India, not everyone gets quality healthcare. If you are financially disadvantaged, you don't get good healthcare. You only have access to government hospitals, but the healthcare and the facilities are not great. And I assume that every country, especially a country like America, everyone has access to great quality healthcare. Minnesota, I saw that's not really true. It depends on which zip code you belong to. Um, Sometimes you just don't have quality, even primary care physicians, it's way too far out, or not everyone has insurance here. So there is a disparity in access to quality healthcare even here. And that was eye opening for me. So it kind of became like a mission that, I need to figure out how to make sure that, just like they say, food, clothing, shelter is like basic rights for every human. How do I make sure that access to healthcare becomes like a basic right for any person in any part of the world? Those were some things which I saw were like very different, at the same time also very similar to where I grew up from.
Right. And so now you're at Weill Cornell and you're in the role of an administrative manager. And obviously what we do here at Grace Institute is train incredible women, like everybody on this call, to advance in their own careers in the administrative field and within healthcare. And the ladies that are on the call today, they may have various levels of experience, with some prior clerical experience, prior customer service experience, maybe some experience also similarly volunteering in a healthcare setting, or maybe some actual hands-on experience as a home health aide, or even working in some sort of an administrative capacity in a healthcare setting. Can you fill us in? Like, what is the culture like at Weill Cornell?
So I would say, if I had to like pick a few words to, kind of like symbolize the culture, it would be a culture of excellence, a culture of growth, culture of empowerment, a culture of compassion and patient-centered care. Like I would say these are like the top 5 words that would come to my mind. I've been here for 5 years, and in my 5 years as an employee, I have felt nothing but supported by administration, by the physician leadership, by the HR in the organization. They're always focused towards your growth, creating policies and creating an environment for you to feel like they value you. And I truly mean it. And I'm like, actually, this month is my 5th year, I complete 5 years here, and I'm happy. I'm still happy to be here and continue my journey here. So I think it speaks volumes to the leadership culture and to just the culture of the organization.
That's fantastic. We talk a lot about that here at Grace Institute, that each step in your career is really to learn and to learn new skills, to put new tools in your toolbox, if you will, so that you can open up the door to whatever may be next. I'll dig into how you support your team with growth in just a moment, but I'm curious for us to learn, what are the specific types of administrative roles that you directly oversee, and honestly, that you would also then be the hiring manager for?
Sure. So under the administrative purview, so I also do recruit for nurses, PAs and nurse practitioners, but outside of those three roles, we have a patient service representative, or we call them call center representative, just depends on, which department you're in. I have a senior medical secretary. They work specifically with each surgeons. We have surgery schedulers whose only task is to book surgeries in Epic. We have billing analysts who work with physicians and the coding team, making sure that the bills that go out to the insurance are are coded appropriately and are sent out. They have an authorization. There's a referral attached to each of these visits. We also have marketing analysts who help with outreach. So, just like marketing about our new physicians, what services we do out in the community to the primary care physicians, or help with our website redesign. So it's marketing, billing, coding, senior medical secretary, surgery schedulers, and a call center or a customer service representative.
That's really interesting. So most people that come to Grace Institute have some sort of a customer service background. And sometimes it can be a little bit confusing when we see the term customer service representative in a healthcare setting. I think oftentimes we have an association of that somebody who's in retail or in hospitality. And we see it all the time in healthcare. So we've had to re-educate ourselves on the definition of the customer service representative job title within the healthcare sector, and why it's such an incredible, especially entry-level opportunity. Can you speak a little bit more specifically on what is that customer service representative? You even said it could be called a patient service representative within Weill Cornell specifically.
Sure. So when you see from a hospital's perspective, customers could be a patient who's calling. It could also be referring doctors who are calling. They are also our customers who are calling in, or it's the secretary calling in from their office to refer a patient. So that's why sometimes we use a broader term as a customer, because patient is not just the only customer that we have. So the task for this particular position would be, ideally you're associated with one particular service. So I have a CSR, a customer service representative, that works with bariatric surgery. We get at least 70 to 80 calls per day per CSR, a month. So it's extremely busy practice. So their job is to, first of all, patients who are calling in for making appointments. There are patients who are calling in to get I need my medical records, or I need my, surgery date. Or there are doctors calling in to say, listen, I have this patient in my office right now, has some, obesity issues, so I need to refer to a bariatric doctor. So the customer service representative helps them find the best appropriate appointment for them, the best physician who would be suited for that particular condition that the patient has, and which physician is in par with the insurance that the patient takes. So they have to, within the first 3 minutes, kind of put all of these variables together and find the earliest possible appointment. So our goal is to give an appointment to a patient within 7 days of the call. So that's patient access for us. So it's a crucial role. And when I interview, people for this role, and I say, you're the front line for us. Anybody who calls our service, you're the first person who's talking to them. So I need somebody who has amazing customer service skills, has, sounds great on the phone, is excited even at like 8 a.m. in the morning, and at like 3:30 p.m. in the afternoon at the end of the day. I need someone who has that infectious energy and, feels excited and happy to be and proud to be part of it. And you are ideally the patient, a person who's handling an angry patient call. A patient calls in, sometimes they could be in pain. And unfortunately, because you're the first person picking up the phone, you might have to take the brunt for it. But that's where I need a person who's compassionate, who can, kind of de-escalate that situation. Sometimes the patient just need, a year to like kind of give their complaint and they're fine. So and if a person who's not suitable for doing that can really cause a problem, because that's when the patients get very upset. They feel like they're not heard, and then it gets escalated to a supervisor, and then it gets escalated to sometimes me. I would want a person who can handle all of that at the front, so that role is super important. It's important that you understand what a patient is talking. So I don't expect people to have healthcare background when they interview for the position. What I expect is once you have the position, make sure you take time to understand. So let's say you work for plastic surgery, make sure to understand the names of all the doctors. What are the different procedures that the doctors do? What is the procedure called? Sometimes a procedure has two different names. Make sure you understand these terms. So when a patient calls, you know what they're asking for. So if you look at healthcare from a business perspective, know the product. Try to understand what is the business that we are in, and understand the services that you're doing really well. So we have all of this information in like booklets that we give out on the first day that you join. We have this information on the website. I tell my team, constantly keep reading about all these the terms, the terminology, so you're comfortable when a person picks up the phone, they're confident that you understand what they're saying. So it's a bit of all of that.
Thank you so much for that overview. And I think that, that highlights, like, for everybody that's on the call, when we talk to employers like Weill Cornell and they're saying we need somebody with great customer service skills, that's usually like one of the first things that they say. We need somebody with great customer service skills, which in many cases, the customer is the patient, which is the patient service representative title. Make that connection. But that it is that front lines position. And it's kind of like, so much happens through the phone these days, that instead of being at the front desk and just welcoming people in person, you're hearing a higher volume of calls, with patients that are calling in to make those appointments. So still heavy on the scheduling, obviously still heavy on the directing and guiding and prioritizing and working with appointments. But it's just being done in the phone, which is why also sometimes it's called a call center representative. So all of these things, call it by whatever name you will, but it really does represent that person who's the first line of communication to the patients who are calling in. And Donna, I see your hand is raised. We're going to get to questions in just about 10 minutes. So just hang tight. So I'm so curious. I want to learn a little bit more about how you support the growth of your admins. But before we get there, let's back it up to, let's just use the CSR role as an example. What would somebody expect to be like the onboarding and training experience for that kind of role?
Sure. So once you start, you have the first 2 days of your orientation week, as we call it. You have like a half day of an HR orientation about the values, benefits, and all those things, and then you spend the next 2 to 3 days with Epic training. So in Epic, even though you have you could have a background in Epic from other institutions that you work, we retrain you again on everything that's scheduling, surgery booking, how to attach a referral, how to scan a document in, how to book an appointment, cancel, reschedule. So that's like a 2 to 3 day Epic training. Earlier it used to be like on site. Now a lot of these services have been moved like over Zoom. So you'll do those. And then you'll get the access to Epic. Then you come on site. So you get training on Epic. We have our phone systems. We are all on the kind of like a call center phone system. So just to know, like, how do you know, like if a call is on your extension, how do you transfer calls to the nurses or to another department, and how to even work these phone systems from the software on your computers if you're working from home. So now we kind of do like a hybrid training. So if you're on site, this is how you would do it. If you're from home, you're going to log in through the VPN of our Cornell, and you're going to log into the software on the computer and then answer phones. So this is the way we also like track our call volume, track abandonment rate, like, how soon do you pick up before a patient abandons the call and things of that sort. So that's the first 3 to 4 days. And after that, what we do is, depending on, again, your specialty, again, let me say if it's plastic surgery, so then you would be shadowing a call center rep from that particular specialty. You'll be listening in like on how they answer calls, how they make the appointments, what kind of, so each also specialty has their own little like booklet that we have. It's an online version, it's a book version where you can go through, like, because you're not expected to know and understand everything as you walk in. So you could refer to the manual, you can learn about the procedures in that manual. We do that shadowing for at least 1 week. And then after that, we give you your access to log in. And then we ask you to like, okay, now you're going to answer the phone calls. You would have like a dedicated person with you to make sure that if you have questions, when these calls come in, that you know to ask the question, you'll start doing it. We don't expect perfection right away. We know you're going to make, but we at least say try. Start answering calls. If you have questions, ask questions, because only way you learn is by actually doing it. You can shadow all along, you can read books, but the true questions on navigating the epic system or to like multitask between various tabs, you're only going to learn when you actually do it. So then that continues for a good month. Then we start testing out, okay, now like, okay, you're on your own today, and then we will assess the call volume. We'll get feedback from the other members. Okay, did you hear her take the call? How was it? Things of that sort. So well, we take our time with training, but we also like start, independently, let you do it by the second week, because that's, like I said, truly that's the time that questions arise and we see how well you've learned.
Fantastic. So there's a ton of training, a ton of support, it sounds like, from both HR managers as well as peers. I'm curious, so if the CSR role is more of the starting point, what would a career path look like for an administrative professional within the Weill Cornell organization?
So I have a mix of everything. I have some individuals who enjoy their role as a CSR and just want to continue being a CSR. That's they love picking up phones. They love talking to patients. So that's what they want to do, and that's one. There are some departments have a very huge call center. It's like 10 to 12 people. Sometimes there could be like a call center manager. So you would be one of the call center reps, but you'll also be managing the call volume. You'll be responsible for the performance of the rest of the call center reps. So that's one. Next one is senior medical secretary. So you could choose to, grow into, that's the next grade up. And this particular role works with one particular physician. So you're assigned to that physician's administrative as well as clinical work. So what does that mean? Clinical work means you're assigned to booking all of that doctor's surgeries. You're assigned to like, you're kind of like the liaison between the doctor and the nurse practitioner who works for that patient. You're the person who calls patients regarding their insurance authorization. So you handle all the clinical aspects. You also handle the administrative aspects for the doctor. That means, booking their meetings. If the doctors travel, then booking their travel, purchasing any supplies that the doctors need. And if you work on my team, I usually also, make sure I give you some kind of exposure to reports. So I have like individuals who say, Sara, I'm interested to learn more about Excel, but I don't have any practice. And I said, great, you know what? So monthly, I want you to create a report of all the new patients that your doctor has seen in an Excel. So that would be an additional task that I would give you so that you keep learning how to use Excel and pivot tables and things of that sort. So that's senior medical secretary. Now, candidates who excel in that role, the next position is a practice specialist or a division specialist. Well, what you do is you continue doing your role of a senior medical secretary, but you would be managing the other senior medical secretaries. Again, let's take plastic surgery, and there are like 5 senior medical secretaries. You will be managing them also. So, you're managing their performance. You would be responsible for entering time. So the weekly timesheet, you'll be responsible for any kind of purchases that we have, which are like, about $1,000. So like capital purchases, putting in the invoice, getting that approved. And then again, depending on the manager that you report to, you would get bigger and bigger responsibilities. So I have like my practice specialist help me with outreach and marketing. I have her help me with like budgeting. But that's because my practice specialist is very interested to move up and hopefully take, my position one day. So it's like my succession planning, training her in the skills. So that's practice specialist. And then you move up to a practice administrator, wherein you manage everything in that division. So you manage finance, HR, quality, regulatory, operations day to day. Technically, you are not doing one job, but you're managing people who are doing all of these positions. So that's leadership comes in, that's what you do. You spend most of your time, leading people, mentoring people, looking at reports, looking at areas of growth within your division. And then some of us then get promoted to like a senior administrator, which is what I do right now. And I manage 3 such divisions. So it's trauma, burns, and bariatrics. And after that, you could become a CAO of a department. So I report, my boss is a CAO, Chief Administrative Officer for Surgery. And I also report to the Chief of Trauma Surgery. So I have 2 bosses. I have a clinical boss who's a surgeon, and I have an administrative boss. So that's a very pretty common structure in a healthcare corporate world. In terms of reporting, you always have like a clinical person and like an administrative person that you report up to. And then after the CAO, then you become like the CEO of the of the hospital, or things of that sort. Yeah.
Wow. So that's pretty special that you just outlined for us how you can basically start as a customer service representative, taking high volumes of patient calls who want to schedule in a certain practice area at Weill Cornell, and work your way up to senior medical secretary, practice specialist, senior practice, all the way up to the CEO. So I don't know if anybody on the call here is aspiring to be the CEO of Weill Cornell, but we just got the inside scoop in how to do it. And obviously no one does that alone. That takes, years of investment, relationships, and learning. I love that. Yes, it is amazing, Gwendolyn. And I think one of the things that we're learning, like we just had another session with some folks from, I want to say it was Wells Fargo, and they were talking about how important it was to having good relationships with their managers that empowered and enabled their success, because there was somebody who they had a good relationship with, who saw something in them, and that they had their eyes and ears, looking out around them for where something was maybe not working right, or where something could be improved. They were curious. And she really reinforced this idea that she looks for people who are curious and engaged in what's going on in their environment in order to support them as individuals who maybe want to move up into the next position. And I know when we first spoke, it really struck me to hear about how you were supporting the professional that also kind of blended into the personal growth of your administrative employees. And I'm curious if you can tell us a little bit about, your approach to that as an administrative manager. How do you work with your team? What does that personal and professional growth look like in your department?
Sure. So this is one thing that I can say I'm very proud of. The professional development starts right from the time that you interview with me. When I interview, I try to know you as a person holistically, not just the person that I see on the resume and your work experience, because I truly believe in like you bring your whole self, you bring your whole experience, not just from your healthcare experience. I have like one of my employees who also does catering. I have another employee who is a part restaurant owner. I'm like, I love all of that. Like bring all your skills to this particular job that you have. So right from the interview, I try to understand them, like where they are, why do they want this position, and where they're aspiring to go. And then what I tell them is, okay, if you get this position, my job is to make sure that you get to the next level. First 6-7 months, pass your probation, do the current job really well, learn everything that you have to learn, get comfortable with your current position. Then I'm going to start making you feel uncomfortable by giving you bigger projects so that you keep learning new skills every year. And I consistently, and I do that. And what I do is I meet with my employees almost like every month, at least once, to like catch up and see where they are, how things are going forward with them. So I have like one employee who wants to become a PA, but she wants to spend a few years in doing administration. She's a senior medical secretary. I have another employee who wants to become a finance analyst, but she's right now in school and she's a senior medical secretary. Knowing where they want to be, I know how to assign them to special projects. That's what I call them, special projects. And that depends on your career interest. And I give them according to that. And I make sure that they keep growing. Cornell also has a lot of training and courses that they give. So again, I assigned them based on the interest that they had mentioned to me. And then outside, I also find a lot of like courses for them. And again, keep assigning them based on what they're interested in. As you mentioned, I for people to grow, what I also look for is their potential. You don't necessarily need to have experience having done something for many years, but does she have potential to do something? And another thing that I look for is the courage. Sometimes I just have employees who say, I can do that project, let me do it. And I will ask questions if I need to be, but like, let me just do it. I've never done it before. And I like that. And I like the fact that they've taken the first step to come and ask me, and they had the courage to come and like tell me that they haven't done it before, but they're very interested to learn. So these are the qualities that I look. So it's also two-way communication. You know, I will check in on you, but they consistently communicate with me how things are going, what they have learned, what do they don't feel comfortable about. And we make sure professionally like they're moving forward. I tell them we all are moving forward together. I want to make sure that every 3 years or 4 years you're ready for your next position. In terms of personal development, I truly believe I live a very balanced life, at least strive for a balanced life. I work efficiently in the 8 hours that I'm assigned to work. That's what I tell my team. Focus on working really well when you're here. Leave on time. Pursue your passions. Take your vacation time. I need you to come back. Don't get burnt out. I don't expect you to do overtime or not take your time off. Do all of that. Those are benefits that you deserve. Uh, Pursue your passion. Is it dance, cooking, traveling, blogging, whatever you have? I think doing that also makes you very creative, and I think you bring all those skills to your current job. So in a way, it makes you a well balanced person. And I ask them. I always like check in on the like how is your dancing going on? Like what are things? So I ask them their progress in life on every aspect. I think it's good. I'm very glad I have a very diverse team and a team that's growing as complete human beings, not just as professionals.
I love that. We are all diverse beings, and I completely agree that what we have in our lives contributes to how we show up in our jobs, and that cultivating those things that just give us that just we enjoy are really critical for us bringing our best selves to our work, to all of our relationships, truly. And I love that you mentioned you have a very diverse team. We pride ourselves here at Grace Institute in also being a diverse team and in cultivating diverse talent, like every single one of the women that are on the call today. And one of the questions that we've been asking our guests more recently is really to speak more about, and this is the last question I have before I'll turn it over to everyone for questions. So get your questions going in your brains. But how does being bicultural give you communication or interpersonal skills that actually helps you in the workplace? Or how does being a woman of color actually allow you to have that as an asset when you're looking for a job and also when you're on the job?
Mm-hmm. Um, so I would say, and this is what I would say to anyone, where you grew up, the country that you're from, your family values, the religion you belong to, the ethnicity that you belong to, all of that adds up to your entire personality. That's what makes you unique. So always be proud of, your background and your diversity and everything that you bring to a table. It's never a weakness. That's what makes you stand out. I grew up in India, in Bombay, which is very similar to New York City. It's a melting pot of cultures and religions. Some of my neighbors were Muslims, Buddhists, Hindus. I think growing up in such a diverse environment, it taught me a lot about customs and traditions that each of these different religions have. And it made me very sensitive in the way I would talk to someone, or it made me appreciate their cultures a little bit more, because they were different from me. I was also very curious to learn more about them. Now, how all of this helps me is today I'm in healthcare, and we talk about patient-centered care, and I feel like that kind of background helps me to be truly sensitive to the different kinds of patients that come to the doors of Weill Cornell. And, that helps me to design a much more sensitive team. It helps me to design process or workflows that respect all kind of people that live in New York City. So I think that my background really helped me over here to be a much more well-rounded leader.
Amazing. Sara, that was incredible. I want to turn it over to our audience. And I saw Wendelin had her hand up and Donna earlier. I see Charlene now. So Charlene, I see your hand is still up. Let's go with you.
Hi, it's a pleasure to have this opportunity, firstly. Hello, everyone. So I had a question concerning the PSR role in big facilities like yours. While you do training that is specific to the job, how do you determine what's a good fit for someone in this position, say in mental health versus pediatrics? How do you know if it's a good fit for that person as a PSR?
How do I know a particular role is okay? So once you're on the job, there are various competencies that we would measure you on. So one would be like collegiality. How good are you at the phone, and how consistent are you with the way you present yourself at the phone? Like I said, there are people who are great on the phone the first 2 hours. Are you still good at 1 p.m. when it's your lunchtime? Are you still giving the same energy at like 4:30 p.m. at the dead end of the shift? So we try to see that consistent collegiality in your tone and in your greeting and in your customer service. That's one thing. Second,
Okay.
what I would see is, your knowledge. So like I said, we don't expect you to walk in knowing everything about that particular service, but if you don't know something, if you encounter something, are you asking the question to the person who's your peer, who's training you? Hey, I heard about this procedure, the patient's asking, where would I find this information? So do you ask the right questions to learn if you do not know something, or if you encounter something for the first time? Now, let's say a patient asks you a very random question, like, is there parking? And you're like, oh, I wasn't trained on this, it's not in my manual. And you can say that to the patient, give me one moment and let me help you. And that's where we would see, do you go above and beyond your script of what you're supposed to help? Because then maybe you can just Google and find out on our website. You could ask your colleague, like, hey, so do we have parking for patients? And you get back to the patient. So we try to see all of these things, your collegiality. Do you go above and beyond to truly take care of a patient's need? And how well are you incrementally learning about the service that you're working for? And if you don't know something, are you asking the right questions so that you do learn? And then another thing that I see is that people ask questions. Are they making notes for themselves, or do they keep asking the same questions every day? Because then that's a red, like a red flag for me. Okay, ask a question, make a note so that you don't have to ask the same question every time. But be respectful of other people's time too. So are you continuously learning? Are you providing consistent customer service? And are you willing to go above and beyond to help the patient or your colleagues?
Okay, thank you. One other question I had. So you train also PSRs in the Epic.
Yes.
Or most companies that use it, they obviously have to train you. What is the demographics that are put in that tells you this is the correct patient? Because sometimes people have different names, may have similar, similar, how do you call it, ethnic traces.
Sure.
How do you determine that that's the correct patient?
Sure. So, we obviously first ask the question if they've been seen before in Cornell or by any of the doctors in Cornell, so we know, okay, this patient has an existing record. So we have obviously name, date of birth, we have a unique MRN number. So everyone who comes in, just like a social security number, I guess. So you would have an MRN number that's very unique to you. So we start usually with these 3 identifiers. Let's say we have I don't know, very rarely that would have someone with the same, all three, and we have like multiple. We would ask like, again, social security would be there, your address. So usually with these three, we're able to like refine and get to the right patient right away, the name, date of birth, and MRN.
And how is that? All right, I'm asking these questions specifically for a reason.
Okay.
Okay, so like I said, sometimes patients use other people's names and they're treated for a certain diagnosis. Is there someone that investigates? And might not be my role, but I'm saying in this field, you are the first point of contact with a patient. So the information that you search for, there should be some key questions you ask besides the.
So these are the key questions, but they also have to send in their ID.
I see.
Yeah. And also when the patients come in to see, they are supposed to bring in that. And there are times that patients come in and their ID doesn't match, and then we have to deny because insurance wouldn't see you also, because then we also verify all the information with the insurance, because you usually have to get an authorization for a visit or referral, and the insurance would be like, we don't have someone who exists with that name. So we have like all of those little, checkpoints before they actually get the treatment from us.
Thank you. Thank you very much.
Yeah.
Thank you, Charlene. Okay, great. Donna, we'll go to you next.
Hello, happy anniversary. Nice to meet you.
Thank you.
Okay, my question is, the call center, is that remote or in person?
So we are in interesting times right now. At this point, it's hybrid, where we have
half and half. Okay.
It's half and half.
Right.
We have them trained. We have all our employees right now, including me, coming in at like not a full time, because it's 5 days for us generally. Now we all come in like 2 to 3 days a week.
Okay.
Some roles have been made remote, like billing, like they don't have to be on site ever. So most of our roles are hybrid right now. We are still assessing the situation. Some of these roles, like especially the call center role, might become full-time remote in the future. But initially, right now, we have everyone come in at least 2 times a week, especially during their training period. We actually want them to come in like almost every day, because there is someone here to like train you, and then someone has to observe how you are doing also. So all of those things, yeah.
And my next question was to move up the hierarchy, is a master's degree required?
A master's degree is required for a administrator and a senior administrator role.
So practice administrator, I'd be safe?
Practice administrator role, you ideally should have a master's degree.
Okay.
But that being said, I have also seen, when I first started here, a lot of candidates who had the potential were said, listen, we could promote you in the next year or so. Why don't you start doing your master's online, and as soon as you complete it, we'll move you, because some of the skills you do need that you would learn from, like skills like budgeting, skills like writing a strategic plan. My role, that's what I do all the time. So some of the skills that you get from your master's is absolutely needed. So yes, then we also encourage you to like, hey, do it online, and there's a tuition reimbursement from Cornell at that point. So it's all of those things. So they support you.
And is there a special university that you're affiliated with?
You mean no, not Cornell is not no.
No, so it could be the of your choosing.
Yes.
Thank you, Donna.
Thank you so much. Thank you.
So we have a special guest, a special surprise guest. His name is Michael Needham. So we just spent the last 45 minutes or so speaking with Sara about the various career paths within Weill Cornell, and we're very lucky because Michael is actually the lead recruiter, specifically for what we call customer service representative roles or patient service representative roles at Weill Cornell, as well as other clerical and administrative roles. And he works closely to help staff Sara's team, as well as other teams within the organization. Hi, Michael. I'm going to ask you to unmute.
Yeah. Hello, everyone. Thank you for the kind introduction, Kiki. I really appreciate everyone attending and taking a moment to allow me to speak today. like Kiki said, I actually hire for the clinical admin roles across the system. Work very closely with Sara. Hello, Sara.
Hey.
um, while we work together, I also work with a number of different hiring managers. So that allows for a lot of, I'd say, leeway as opposed to what the managers are looking for. I'm not certain of everyone in the group and where they are in their station and where they are in their career. But what I can tell you is the roles that I hire for, they range from individuals that have little to no experience in the healthcare side of things to at least, I would say, upwards of 10 to 15 years. Because I also hire for practice specialists, practice manager, and practice supervisor roles as well. Those roles on the top end, I'll get to those later, but on the front end, a lot of times when I say front end, it's actually a good analogy because most of these individuals will be working very closely with the patients at a front desk or front desk role or over the phone. And they may be the face of the organization. They may be the first interaction that patient has with Weill Cornell. So it's very important. It's a lot riding on that interaction. And when I say riding, meaning reputation wise, and that's valued, that experience is valued across their whole plan of care while they're with us. So that initial conversation lends to a handoff to maybe someone else that's a little further along in their plan of care, maybe a pre-authorization specialist, a surgical coordinator, back office, senior medical secretary, or someone that's even up to the physician. So if they're looking for premier, solid care from a physician, which you're going to find at Weill Cornell, they're looking for that in that initial interaction with our patients.
Fantastic. Thank you for that overview. And
Yeah,
we
no
would
problem.
stay focused on the entry level or those front end
Okay.
positions for the purposes of our conversation. That's
Mhm.
really where everybody will be at in this call.
Okay.
But while we have you for, the next 9 minutes or so, I would love to know, Michael, do you want to share a little bit about any of the roles that you're currently needing to source for or that you foresee? I think, so everybody on this call will be graduating from the class at the end of the month. So
Okay.
anything that you foresee that would be starting in early to mid to late April, they would be interested in, and then give us a little insight into what specifically you look for in terms of skill sets or core competencies for folks going into those front end roles.
Okay. Let me start by saying what I'm looking for in particular. Um, Most of the time, before I even reach out to you, I've already talked to the hiring manager. Um, I've already talked to the hiring manager about what they're looking for. So you'll see a job posting, and that job posting will have some critical areas that an individual would have to have experience in. But for the most part, some of the managers also have some things that they're looking for, the soft skills. And those soft skills, they pertain to your enthusiasm. If you're looking for an opportunity, if you're looking for your keys, you're looking for your keys in a frantic manner, almost as if I need these to move around. We're not looking for you be in a frenetic pace, but we're looking for you to be as interested in finding your keys as you are looking for that job for sure. Because if you're looking for a position and you're just like ho hum, um, we're not looking for ho hum for our patients because they're coming to us in their greatest time of need. And their greatest time of need is going to they're going to need someone that's actually going to be an ear, and they're going to enthusiastically entertain the conversation that they're having either over the phone or in person. I'll get right to that. I'll get right on that. That's a soft skill that's a little hard to teach when someone has experience in the back in that field, but they're approaching it as if this is their 50th person that they've interacted with today. That first interaction should be just as solid and just as sound as the last interaction of the day. A lot of managers are finding themselves having to coach up a lot of the employees throughout the day to that aspect of the job. The other piece would be being reliable. It's sad that we have to have these conversations about reliability and making yourself available. We all know people have, outside obligations outside of work. Work-life balance is important as well. But at the same time, having someone that's reliable, even in these times, there's a lot of calamity going on around us. There's a lot of uncertainty. But if you're able to stand and deliver and be accounted and stand up and be accounted for, that goes a long way. You know, that speaks more volumes than your resume. If you're accountable and you're present daily, and your your attitude and your disposition is consistent, no matter what's going on around you, that actually speaks to how you're going to perform under pressure in the practice. So these are things that it's not going to show up on your resume, but individuals have, like, even if I just speak for myself, I have experience with multitasking and dealing with things and finding work-life balance. But at the same time, it rarely, if ever, bleeds over into my job performance and those core competencies that I'm able to present, at work. The next thing would be communication, clear, concise communication. So if I ask you how your day was, um, and it's a one-word answer, that's feedback, of course. But at the same time, if I ask you how your day is and you tell me, well, my day at work or my day at home, both are different. One is actually relying on me for life and death. The other one is relying on me to be able to stand and deliver when called upon. Like, these are, ways we can actually work our way around to being solid communicators. We're not asking you to be, a great orator. We're just asking you to be a good communicator. Because what's important is, when we're talking to patients, we're relaying information, literally relaying information from the patient's mouth to the physician's ears or the physician's eyes when they're reading it in our, in Epic. It's important that we are picking up on some of these clues to where a patient is in their plan of care. A lot of times they don't know how to explain it. But if we know enough about what we're doing at our practice, and we're involved enough with the success of our practice, we're going to know where they are in their plan of care. We're going to know how to triage that phone call. Not asking you to be a medical expert, but we are asking for you to be attentive and a solid communicator. That communication goes a long way. So if a manager asks, because you all can pull from certain experiences that you have in your work life, if a manager asks, tell me about a day that was difficult for you, you should have clear examples of, you know, how you turn that negative interaction, that may or perceived negative interaction, into something positive. You'll be surprised that when we're on the interviews, how rare it is to have someone give you a snapshot into a scenario, to what's happening in their day to day. And that conversation, that part of the conversation, lasts about a half hour without someone interjecting. It's almost like we're telling the story, and then we're telling the story to get feedback. But that arc of the story we're telling is what we encountered with, how we identify the issue, and then how we kind of move to a solution. Really, that's how the arc should be during that part of the conversation. That shows your communication skills. And the clear and concise part is that you used language that's understood by that person, understanding your audience. So if you know you're working with someone in the healthcare field, speak to how, if you're in retail now, how that retail experience mirrors an experience in healthcare. You may not have the experience in healthcare, but you also have the experience in dealing with individuals, dealing with people. And when you know where there's people, there's personalities, and sometimes there's conflict. How you work through those conflicts also it speaks to your skill set as well. So the last piece I'll leave with, now we're working in a virtual space or a virtual environment. Your background and how you present yourself, when I say background, I mean literally what's behind you, is going to reflect in how you're presenting. Before, you used to worry about a tie and how your shirt looked or something. Now we're actually worried, and people are looking at how attentive you are during the call. They're looking at how attentive you are or if there's no distractions behind you. These things they're taking into account. These hiring managers, they're very keen on now looking to see, how you set up your environment leading up to the call. That shows how you've prepared to present yourself today. That's a part of your presentation. So I would take that into account as well.
Wow, Michael, I don't know. You just gave us so many gems.
Well, okay.
Ladies, can we get a clap on the reactions if you heard what Michael was saying today? Yeah, I feel like I just went to church. I mean, I went to recruitment church. Wow. Okay, so I'm glad that this is recorded. Everybody who is here, I see celebration icons. All right, everyone's up, alert, awake, everyone's ready.
Right.
Everyone's here, everyone's thinking about those examples when they have dealt with a challenging customer, what the situation was, what the actions they took were, and how it was resolved as a result of what you did. So we're learning all about these behavioral / situational interview questions here at Grace Institute in this training, amongst everything else that these ladies are learning around EPIC and insurance and medical terminology and patient services. So we're so grateful for the insights that you offered here today. For folks who are interested in applying to any of these roles through Michael, or potentially if you are blessed enough to make it into Sara's team, Mathew Potter, who is on the call. Go ahead and yeah, there you go. He was shouting himself out. He's the gatekeeper to those opportunities. So you're going to want to build a relationship with him. You're going to want to use that clear, concise communication with him to tell him what you want in your career, so we can also help direct you in the right direction. So Michael, thank you for this insight. We'll be following up with you with resumes. And go ahead.
No problem. Thank you for the opportunity. It was nice meeting everyone. And hopefully we'll cross paths in the future.
Likewise.
Kiki, I think Laura has a question.
I see.
Oh,
okay, Laura, feel free to chime in.
Good afternoon, everyone. I would like first to say thank you to Ms. Matthews and Mr. Needham for granting us all this opportunity. My question is, what do you look for when choosing the right candidate for a specific position with transferable skills, but with minimum working experience in a hospital or medical setting?
Okay, I can answer on my behalf. You can hear me?
Yes, I can.
All right, great. With minimal experience, I hire individuals all the time with minimal experience in a healthcare setting. That role most likely would probably be a patient coordinator role. And a patient coordinator role will probably have a background with either customer service or in a retail setting, or even just in an admin setting, but just not in healthcare. And then they may also, be a new graduate from college, or they may just, their job they may have been furloughed because of COVID. It's so many different circumstances leading up to that would allow us, again, to speak to kind of where they are in their career, a candidate is with that kind of background.
Okay.
It would take a screening, and the screening is going to kind of give us insight to that. And then you have to understand too, I'm sorry to maybe go a little further into it, but we're not only advocating for Weill Cornell, we're also advocating for the candidates as well. That advocacy starts with understanding your story.
Okay.
So if you can clearly explain that to me and how you ended up where you are, it's easy for me to talk to Sara and say, Sara, this person was previously in retail. They were about to be promoted, but COVID hit. And then when COVID hit, kind of scaled back on some roles, and she lost that opportunity for promotion. And she also ended up losing her job as well. She's looking to get back in the workforce as soon as possible, but she has interest in healthcare. This role, I think, would be a good fit for her. That's kind of how the call or the email would be.
Okay, thank you. May I ask one more question?
Certainly.
Okay, what does Weill Cornell value most in their employees?
That's hard to speak to across the system with the Weill Cornell, because that value is very different. Because you have to think we're in the cutting edge of research.
Yes.
They may value someone with a skill set of research way more than they may value someone with, the ability to work with clients and customers. But at the same time, I think there's one underlying theme, and that is the empathy towards our patients and the concern towards our patients. Because you have to understand the first and foremost responsibility of any position that I hire for is patient-centered. It's quality patient care that we offer at Weill Cornell. So that's what we're going to value most. We're going to value that desire to help others more than, we're going to weigh more heavily than anything else.
Okay, because I did see on the website you guys have care, discovery, and teach. That's 1, 2, 3.
Absolutely.
In that order.
In that order, yes.
Yes.
Care in general, for sure.
Okay, thank you.
You're very welcome, Laura.
Fantastic. Thank you, Laura. Well, that brings us to a close for our Q&A with Weill Cornell. Thank you so much, Sara, for the generosity of your time and insights. Michael as well. I feel like we just got the secret code to how to succeed in Weill Cornell land. So ladies, take all of this, share notes with your colleagues in the program. We look forward to chatting with you about these opportunities after the fact and working with each of you individually. And then the last thing before we go, we like to ask one final question in these sessions. And this one is for Sara. What is advice that you wish someone would have given you in your career path in order to succeed?
Okay. I would say, I wish someone would have told me that as a manager, as a leader, you're not expected to have answers to every issue and every problem that comes your way. If you don't have answer to something, or if you can't figure out a solution right away, it's not a sign of weakness. It's a sign that you're doing bigger things and you're growing. And it's a sign that you should learn to lean on your colleagues, your team, your leadership for advice. So yeah, just be confident and just, be authentic. I would say that's huge with me. Be authentic, know the value, know what you bring to the table. And there are always things that you're not gonna know. And that's okay. As long as you're humble enough to accept that and learn, ask questions, lean on people around you, you will move up in life.
Amazing. Thank you. Phenomenal session today. Thank you everybody who joined. Thank you again, Sara and Michael. And that wraps us for today. We look forward to chatting with you next time.
Thank you so much. Take care. Bye.
All right. Thank you, everyone.